All right, Corporate Governance Minister Velenkosini Hlabisa has embarked on an emergency visit to the Eastern Cape province. As 28 initiates died, the minister will consult all key stakeholders and possibly consider temporarily suspending the practice to address the deaths. Now, DearSA, an initiative during giving South Africans the opportunity to contribute to policies on cultural heritage, is calling on the public to contribute to government's draft customary initiation regulations. We're now joined by the organization's spokesperson, that's Noluthando Hlophoyi. Noluthando, very good morning to you. Thank you for joining us for this very important topic. First of all, your reaction to Cogta Minister saying that if the meeting with stakeholders does not pan out and they don't get a positive response, they might consider halting the practice altogether.
Good morning. Thank you for having me. First of all, I do understand. So this whole topic, even this whole right now, it's actually quite a very sensitive one. And I understand why the stakeholders don't want to come through and have a conversation with the minister, if I didn't really get that right, because it's always this, it's quite a contentious topic in our, let's say, call it Eastern Cape. And it's actually, that is why you find that they're unable to have this discussion right now. And hence we are saying, as an organization, the public should have a say on this. And also the reason of that is because of it's a secret, and the whole thing, it's quite a sensitive topic. That is why you find them that they don't necessarily want to have this conversation about 28 of the, let me call them, young people that have died right now, which is quite a sad story. Right now.
Yeah, totally unacceptable. I mean, 28 is 28 too many. And I feel like, I don't know if you feel the same way, that we've been having this discussion every year of making sure that initiates are protected, they're safe, and that this practice is done in a dignified manner. When we speak of stakeholders, I know that word gets thrown around quite a bit. You're advocating for the public to participate in looking at these regulations and giving their input. Who exactly are we looking at outside of the public when you speak of stakeholders that are important to be a part of this conversation and looking at these regulations?
Listen, stakeholders, we're talking of the men, or we call them the elderly, who tend to be part of the whole process. We're calling them in. Those are the stakeholders. For that matter, even parents are the stakeholders, if you think about it. So it's the elderly, the men, the community, even the elder men who actually do the process of initiation. So these are the stakeholders that we're talking about. And the reason being is because the sensitivity part of this conversation, or rather of this whole thing, it's because I would say they feel that they own it. And because they own it, they don't want to talk to anybody else who hasn't done it before. It's a very sensitive situation as I understand it. And right now, I remember I've been doing the research. For that matter, I'm a woman, of course, I'm closer, but then the whole thing is, I was telling them, if young people were not dying, I wouldn't even be here talking to you right now. I am a nephew. I'm sorry, I've got two nephews who actually went through the process. They came back, we were happy. But then if others are dying, I can feel the pain of other parents who actually take them there. And at times, the parents is not just two parents, it's actually it's a woman who's taking them there. And you can imagine the pain of having to lose the child when they went there, and they were hoping that they'll come back. So now we are saying we didn't want to be part of it as women, but then when there's children who are dying, then that makes it our problem. So that is why I'm here.
Yeah. And as DearSA, you've put out a statement, an intro, I think we read it, but just for our viewers who have just joined us, you're saying you're calling for this public participation to protect, to look at the regulations that protect the health, the dignity and cultural rights of initiates while preserving the nation's constitutional principles. Looking at the regulations, what sticks out to you the most as something that the public should really look into in terms of encompassing all these aspects that are mentioned in what you're trying to achieve?
Listen, we as an organization, we are not saying the tradition should be banned. No, we are saying the public should have a say. We're saying that now it's the time for the public to really get part of this and to have a say about what is going on, particularly about the kids who actually are dying. So we are not saying it should be banned or anything like that. We are saying it's high time that the people, that the parents who are losing their children should have their say. Even if you're not a parent, I know you might be an aunt, whatever, but we are saying it's high time that we have a say on this matter, because we have been going through this for years now. And if we as a public will continue to watch, it will continue to happen. And it's actual fact, that is why the government and the regulation will enter, because now it might also mean that, as you've heard right now, that the whole tradition, it actually will be bent out, and people won't actually go to the initiation schools. So we're saying we want to keep this, and it's something that young people want to do, young men want to go and do it as a rite of passage, as you know it. But then at the same time, we are saying it should be done in a safe manner. And at this point, the public needs to actually have their say on this matter, because it's important, and it's something which affects us every year, twice a year. It's in winter and in summer right now. So it's something which we want everybody to have their say on.
And we talk of, there's young men who are quite eager to make sure that they practice their tradition. They have a sense of pride when they go to the mountains. The issue of consent, which I think you've raised quite a bit there, is that addressed in these regulations? Because we're speaking of boys that are aged between 16, 17, 18, some are older. Perhaps the age of consent in this country, of course, being 16 years old. The right of refusal, also parental involvement. Are the guidelines stipulated with how that is dealt with?
The guidelines are there. However, can you imagine in a household where I'm a young mother and I have this young man who wants to go there, convinces me, brings my uncles and others to say, hey, I'm ready, I want to go there. So there's also the element of cohesion into this whole thing. And that is why you find that they can go at 16, which is they're quite young, for what it used to be before. Because before you'd find men who are older than 18 who actually would go there. But now, these days, a young man can convince a parent, And I believe that if there would be, for instance, a household where there's two parents, you'd find that the father would say, no, you're not ready. Now, because we are living in a society where there's more women, that is why you'd find that there would be a cohorts to actually agree with this young man, and then they would go there. But then, however, now when you're talking about regulation, or rather, yes, the stipulation of the rules, that young man should be actually guided by the men who are there, or rather the elderly who are there, to say, no, this is a young man. He's not ready to go there. So therefore, he would go at this certain age. But then because now we are saying he says he's ready, then we just take them through. So there's this ambiguity when it comes to the regulation. Exactly how old are you supposed to go there, and how old are you supposed to be for you to actually say that you're going to be initiated. So there's a lot of ambiguity. And as we say, as a woman, we don't know much. This young man might take advantage of me, and then they might agree. That is why also that's the whole thing that happens.
Yeah, and of course there's the issue of abductions that we've heard of, illegal initiation schools. I want to pick your brain when it comes to others that argue that perhaps there's a clash between traditional governance and modern systems to ensure that these practices are done in accordance to accepted traditional norms. Do you think that there is an overlap between those two?
There might be. I believe there is an overlap. However, we're living I don't want to say in a different society, but times they actually necessitate certain regulations, or rather certain things to be done in a certain way. For instance, as we are actually speaking, we're living in a times where you find that it's important maybe to have a doctor who will do this, and also have the elderly there to be of, let's say, of mentoring and making sure that the young men are going through the process properly. Also, or rather, we'd say that the elderly who do the process, they need to be actually having to go to a process of being taught first aid kit, being taught on how to make sure that the children who are there, they are protected, the children who are there, the whole thing is done in a manner that will make sure that they get home, meaning making sure that the first aid as well as the health perspective of the children actually is protected. So I would say that the elders need to really open up their eyes and even open up their ears. And be willing to understand that the healthcare practitioner need to be there, either to teach them, to make sure that the health part of it's done correctly. So there is an overlap there. Others, they feel that when they do involve the part of the healthcare practitioners, they might be actually losing the whole tradition of part of it, of which is not necessarily true. Because remember, when that part is quite sensitive. For instance, in our side here, which is in PE, you'd find that the health practitioners are the ones who are doing it now. So we've embraced it. We've opened up, and that is why you'd find that it's seldom to find that a young man is actually dying. But on the other side of Eastern Cape, the older men, they still want to hold into it, because when there's a health petitioner, they feel that they're losing the whole tradition, which is quite not true.
Yeah.
Because it's important for them to be there for the safety of the young man.
Absolutely. And the whole conversation really has been about safety. That is the biggest concern of parents and government. Very quickly, Noluthando, people that want to participate, the public, where can they do it? Because a number of people say, look, we want to be a part of this conversation. We want to give you a take, but we just don't know where to do it. And also, when is the closing date of when the public can participate?
So the public have got this month, so they can go to DearSA.Africa. That is DearSA.Africa. That's where they can actually have their say on this matter. And the date, of course, the whole month of December, they can have their say on this matter.